why we're talking about healthcare and project management, and why we created in the most ancient, the most traditional association of project management in the world, why we create this topic, why we want you, why we want your help. And that's the key point that we're here to move forward together. So let me introduce Juliana. Juliana can introduce herself. She's one of her kind. She's a specialist in all kinds of planning, strategic planning, about motivation leadership. She's the one. So Juliana, can you please explain a bit about yourself and why your eyes brightened when you came here and we together decided to create this healthcare specific interest group?
I am Juliana Pá, a strategic planning, programs, and portfolio manager. I have worked in several sectors, such as industry, upstream, consulting, and healthcare. At the moment, I am a co-leader for a specific healthcare interest group because I am passionate about this healthcare. It's the industry very complex. Then it needs to implement projects. It is now Rafa sent me the participate the project management.
So it's important that almost 10% of our GDP in Brazil is spent in healthcare sector. There are some countries that will go almost to 20% of the GDP. So it's a lot of projects going on, a lot of developments, a lot of challenges that we have regarding that the population is growing and aging. So it's a new outfit that we need to understand here, and now we need to the economy is projectized. So we need to understand how this is going to move forward and how we can face this challenge. So we're here basically to help this specific scenario to move forward. So we saw during pandemic, all the flaws that we had regarding project management. So we needed to create new hospitals of campaign. We needed to create a vaccine that was succeeded. We had a lot of movimentation in the world, a lot of needs, a lot of care models that's going on, and we needed to mobilize quickly. So when talking about project management, some professionals believe that you're talking about or IT or engineering, and it's not. When you talk about project management, just take a look in the meaning of the word project. Project means that something you're making a projection of a better future instead of the present state of the status quo. So every time that we wanted to change the status quo, that you want to create something new, that you have an idea, that we needed to mobilize resources and you put this through time to create some kind of benefit for a specific stakeholder analysis, that's what about project management is. So if you're a doctor or a nurse, anyone from the healthcare sector, you can benefit from that because it's to take a new idea. And this exposed cracks in the healthcare system just enlightened that we need to move together to take the best practice that we have in IPMA, which is the anxious Project Management Association, the international project management that was founded in '65. So we needed to join forces together. That's the reason why we are here. We need to have the modernization of this, the approach that we have to healthcare sector. We need to help public policies and to implement as projects, the public policies. So there is a lot of potential that we can move forward together. So that's the pain that we're trying to looking for, to make an equilibrium of the cost saving, to improve quality and meaningful use of the resources. That's the key that we have been thinking together, me and Juliana, how to help the healthcare sector, that we can move into a specific approach to project management. It's important for you who is listening to us right now that you can write your questions in Q&A box. If you need something, we are here to also to answer, at least in my presentation. We're going to have more free presentations during this night, which you're going to be glad that you're going to have amazing professionals showing you how they are doing in real life. That's why we're here. We're showing how we can implement it in a successful way that you can use this in your daily life. So this approach of understanding this equilibrium, we wanted to deliver better service to patients, to the population, and to providers, to make an integration among themselves. And we can show that the synergy among the supply chain can be done by project management approach. So moving forward, what's the composition with who you want to talk to? That's important for you to understand. When we talk about the healthcare sector, it's too broad. It's not about only the hospitals, but it's the healthcare services and facilities, the manufacture of medical devices, equipment, and hospital supplies, the medical insurance, medical service, and managed care, and pharmaceuticals and related segments. So it's a huge and broad chain that of supply chain that we're talking about. It's about the whole chain. And Juliana, can you share with us some challenges or some challenge that come to your mind regarding this integration, since you are one of the most skilled professionals that I have ever been known, which is acting in the sector?
Yes, I did a presentation that I use the share screen, please.
Okay, I'm going to just to end this small presentation here, and you start to make your
thank you.
presentation. And then so Julian is going to show us an incredible case regarding the applications of all some tools and techniques that we have here. And the most interesting part about our approach is that we build competences. It's different from just knowledge-based approach. So why it's so important, Enrico, I'm going to answer you right away, okay? It's important for you to understand that we have today in the world two basic approach for associations or institutes to project management. One is based in knowledge and the other is based in competence. What does it mean based in knowledge? So you have a reference book or have a guide and you refer yourself to this guide. That's what we call about knowledge. It's important because this frames you, this gives you a perception, dictionary, and a glossary that you can understand the main purpose of what we're saying. When you go to competence, and we develop here a book specifically for healthcare sector, we wanted not only to show you the meaning, but the using what you're doing. So that's the main difference that we do. We not only explain what's the concept, but we explain how you make the immediate application of what we're saying. So later on, we're going to make this available for you that you can download this, okay? And what we do here, that's important. We have a lot of opportunities. We can conduct research. We want here to make exchange of experience. We have here the dissemination of adopted tools and techniques for project management by different angles, different aspects, different professionals. We have here something very interesting that Juliana is probably going to say during her presentation about to have a specific methodology for not only to project management, but also to portfolio management. And we are here more than willing to find ways to talk to universities, to professionals. So here is the starting point to the public. We have been growing our roots under the ground for the last 2 years. Now it's time to go live. So here is open space that you can feel safe to share the experience that you have if you are in the area of healthcare, or if you're not in the area but you're curious about being in the area or you like to be part of the process. Please come to us with your needs, with your ideas, that we can help you to develop this process during the way. Okay. So Juliana, I'm going to, and we have here, IPMA has a different approach. We have a certification for level of competencies for professionals. So beginning with the beginners, who is in the basis of the organization, who is organized the organization, until the project director. So we have 4 levels of certification for individuals. And we have here too a certification for the governance that links the strategy in order to have the implementation of projects in the field. So IPMA is very different. Besides this, we're going to make a new webinar just to talk about this more properly. Now, my idea was just to present you what is the SIG healthcare. We have the contact here. I'm going to put this once again. And I'm going to stay the floor to Juliana, that she can make her presentation. And once again, thank you very much for those who is here listening to us, wanted to deliver better and unite ourselves to make a better world for better project management. Thank you very much. And Juliana, now I'm going to send you the
Thank you, Rafael. Okay, thank you. Good evening. It's a pleasure to be here with you today. Before getting started, I would like to thank Dr. Rafael Bergarias, the panelists, André and Raquel, and the guests. Thank you. This seminar prompts to provide a comprehensive view of current trends and challenges in the healthcare sector, highlighting the keys to success and strategy for shaping the future of healthcare. Oh. 1 moment. Okay. I am Juliana Pan. In the QR code, you will find more details about me. Well, we will address the most serious perceived risks to economy and society in the next 2 years. The world's collective focus is being channeled towards survivor current crisis. Cost of living, social and political polarization, food and energy supply, tech growth, and geopolitical confrontation, among others. On this slide, we present a map of global risk interconnections divided into 5 categories: economic, environmental, geopolitical, social, and technological. The global cost of living crisis, driven by risks such as energy supply, rising inflation, and food supply crisis in 2023, it's already being felt. Countries with financial resources can better cope, but nations with low-income populations facing multiple crises include debt, climate change, and food security. Persistent supply pressures risk turning the crisis into a humanitarian emergency in many important dependent markets over the next 2 years. The impacts will be strongly felt by the most vulnerable segments of societies and by already fragile states, contributing to increased poverty, hunger, violent protests, political instability, and even state collapse. The economic consequences brought about by COVID-19 and the war in Ukraine are reflected in the rising inflation and swift actions of public authorities to control it, resulting in interest rate normalization. The actions taken are likely to have repercussions over the next 2 years, where banks may face inflexible inflationary pressures. The age of area of low interest rates will have significant ramifications, particularly for governments, companies, and individuals, with the most vulnerable parties feeling the effects most intensely. Fueled by military and state aid expand, as well as private investment, research and development in emerging technology will continue to advance rapidly, driving progress in AI, quantum computing, and biotechnology. For countries that can afford it, these technologies will provide partial solutions to a range of emergency crises, from addressing new health challenges and reducing healthcare capacity, to scaling food security and climate mitigation. For those who cannot, inequality and diversion will increase. The increase in cybercrime and the attempts to disrupt critical technology-enabled resources and services will become more common, with predicted attacks on agriculture, water, financial systems, public safety, transportation, energy, and national communication, weakening individual digital sovereignty and the right to privacy. Global public health is under increased pressures, and healthcare systems worldwide are at risk of becoming inadequate for the purposes. The COVID-19 pandemic has further exacerbated the ever-present spectrum of emerging risks to physical and mental health, including antimicrobial resistance, vaccine hesitancy, and climate-driven nutritional and infection disease. As current crises diverge resources from long-term and medium-term emerging risks, the growing burden on natural ecosystems will increase due to their still undervalued role in the global economy and the overall planetary health. Nature laws and climate changes are intrinsically interconnected, with failures in one area leading to successive failures in the other. In the absence of significant policy changes or investment, the interplay between climate change's impact, biodiversity loss, food security, and natural resource consumption will accelerate ecosystem collapse. Creating food supply and livelihood in climate vulnerable economies. Amplify the impacts of natural disasters and limit further advances in climate mitigation. Global changes have increased the risk of infection disease outbreaks, even as improved sanitation and healthcare access have resulted in considerable progress worldwide. Modern lifestyle habits, socioeconomic inequality, and an aging population contribute to big current prevalences of chronic disease. Geopolitical fragmentation will fuel geoeconomic warfare and intensify the risk of multi-domain conflicts, leading to increased conflict between global powers and state intervention in markets over the next 2 years. Economic policies be used defensively to establish self-sufficiency and sovereignty for rival power, but will also increasingly be deployed offensively to limit the emergence of the others. Poor mental health is an increasingly serious problem in society. Systems have largely underestimated its importance compared to physical health, while pent-up demand for support and deals in intervention are worsening the problem. The stress, uncertainty, and losses during lockdown have left their mark on many people. Approximately 1 billion people live with some type of mental disorder worldwide, according to the World Health Organization. In Brazil, 90.3% of the population deals with anxiety, making it the highest in the world, while 5.8% grapple with depression. There are several trends impacting healthcare providers in Brazil. With the demographic change, there will be increase in chronic conditions such as diabetes, obesity, etc. In addition, a study carried out by the OECD shows that there will be lack of health professionals in the order of 80 million by 2030. Consumer behavior has changed over time, seeking care that is more focusing on their needs and in a more accessible and comprehensive way. The incorporation of new technologies for care beyond the walls of hospitals will allow a decentralization of care to the patient's home. New payment models are needed, in which risk sharing and patient profile are assessed in funding. When we evaluate health trends, it is noted that significant changes will have to be implemented. Effective project management plays a crucial role in responding to global risks, enabling organizations to face complex challenges, adapt to change, and promote sustainable development. The disciplined approach to project management allows organizations to plan, execute, and monitor initiatives that directly address the aforementioned risks and challenges, contributing to a more resilient and secure world. I invite everyone to download the competence framework for individual in healthcare project management in the QR code. Thank you for your attention. I will answer questions throughout the program in the chat. Thank you.
Incredible, Juliana. Great presentation. And please, for those who is listening to us now or going to see the record, use the QR code in order to get access. Juliana, can you please just present again the QR code to the book that they can make it available and download it? And soon we're going to call Raquel to the stage and we move forward.
One moment, please.
Discussion. So this is a great book. So for those who is here, it's for free. So you can download it. You can understand a bit what is project management into your reality. It's not only here, it's not about only project managers. It's very important for all of us here understand what we're moving forward here. When you talk about the competence of project management, you're talking about how to turn an idea into reality. So this is for doctors, for nurseries, for everybody who wants to create some new protocol to make a better comprehension of your organization, to make to come through with a new protocol. So it's very important for all of you to understand it's not only for project managers, but it's a competence for everyone who is in charge of creating the strategy or to be in charge of a team or needed to lead changes in the organization. So it's very important. This book's it took us almost a year to have this done. So please download it. It's for free. You can get in touch with that and develop yourself. That's what we propose in here. So I'd like here to introduce Raquel Conceição. She's a great specialist. She's going to present herself, her curricula, a bit of her experience. And please, thank you very much once again, Raquel, for accepting this challenge to do the part of the first webinar that we're doing in this healthcare SIG. And you're more than welcome. Thank you very much. The stage is yours. So please, if you have a presentation or wanted to share, feel free to present. And thank you very much once again.
Okay, good night, everyone. So thank you, Juliana. Thank you, Rafael, for the invitation. My English is a little bit rusty due to COVID-19, so I'll speak slowly, and hopefully it will be a good night for all of us. So let me share my presentation. Do you see? Is it okay? Do you see my screen or?
Your screen, no a presentation. It's a
beautiful view, by the way.
A beautiful view, yes.
Me and Zoom.
No worries, take your time.
Disappeared.
Do you prefer I share you?
I prefer because I have two screens and I don't know why when I try to share, everything disappears.
Okay.
Thank you.
No problem.
Muito obrigado, minha amiga.
One moment.
I'll just introduce myself. So it's a pleasure to be here. I'm a doctor, so I'm a gastroenterologist. I was trained at Mayo Clinic in liver transplantation, where I worked for 15 years here in Brazil in different hospitals and services. And then after 15 years, I had my daughter. She's 20 years old now. But then when she came to this world, I decided to change. So I shift my career to a manager, to business. And then I started studying. I did my MBA, my PhD. And then I specialized in developing business and creating, implementing, and monitoring business, healthcare business for companies. So here in Brazil, I worked for a large hospital called Hospital Albert Einstein, and we had more than 500 clients, several sizes. So this is what I was working until last year, when I decided to quit and to start my own business, which I named Loops, to because my daughter, she's called Elena, and Elena means lux, so it means light. So that's what I'm working, and I want to share with you some of my previous experience. It disappeared also, Juliana?
Yes,
Magic.
sorry.
The same
One
with me.
moment.
My
Oh
presentation is
my God.
magic.
Oh, I lost the oh, sorry. Mm, one moment. I lost the presentation.
The
I'm
same
so
happened with
sorry.
me.
Oh, one moment.
The same happened with me.
Okay. Yes. I see. It's
Well, here in São Paulo, we are reaching
okay.
40 degrees Celsius. Thank you. The next one. So I was just introducing myself. Now I want to introduce you. I think there's one slide before where I talk about
Oh,
health. I
sorry.
think.
Oh my God, you. Of course, I consegui.
Tá muito estranho esse zoom aí, menina. Se subir, se rolar, vai subir. Não, está descendo. Se subir. Mais. Pode ir, pode ir. Aqui do lado direito tem umas pagininhas, 1 de 37. I'm speaking Portuguese. First language
Oh
came to
no.
my mind. I'm glad I'm not the only one.
Okay. Okay.
Share.
Yes. Okay.
So, first thing, what is health? Health is the state of complete physical, mental, and social well being. It's not merely the absence of disease. This is the first key message I want to address you. Pode passar, Ju. So, health is wider than we think it is. And on the other hand, mental health is a state of well being in which the individual realizes his or her own abilities, can cope with normal stresses of life, can work productively, and is able to make a contribution to his or her community. So that's why health and mental health, they need to be together. When I read a lot of news about well-being, about medicine, full medicine, this is not new. This is from the last century. So mental health is the ability that we have to contribute, to make relationships. Pode passar, Ju. Mental health, what I want to highlight here is when we think about mental health, it's not being ill. So if I'm sad or I'm not sad, if I'm depressed or I'm not depressed. So since I've been working with companies for a long time, what I always hear from managers, but explain me why if this employee, if he came back from a burnout or a depression, why he's not performing the way he used to perform? Because mental health is a continuum. It exists, so a person can experience different emotions throughout her life. So I can be mildly depressed and perform. I can be anxious and perform. So it's like a continuum. I'm not well on a daily basis. So this is what we have to have in mind. And a person who is treating her mental ill, this person can work, can produce. She can be healthy even if she has a disease or a previous diagnosis. So, health is not the absence of disease. Mental health is the same. Pode passar, Ju. Health is not an individual issue. It's influenced by several conditions, and I want here to highlight the social determinants of health. They encompass economic, social conditions that influence the health of people and community. These conditions are shaped by socioeconomic positions, amount of money, power, resources that a person has. And all of them are influenced by socioeconomic and political factors. So health is affected by socioeconomic, cultural, and environmental conditions as well. So we need to have this in mind when we are managing a project or we are dealing with a company in different parts of the world. That's why I came here. That's why I think it's important to highlight that people have different determinants of health in different parts of the world. So what works here in Brazil doesn't work in Croatia or even in India. We have to understand the social determinants of health. Pode passar, Ju. And why? Why am highlighting this? Why? Because condition in the places, so where we live, how we learn, work, and play affects the outcomes, affect how long I'm gonna live, and how I'm gonna live. So depending on where we live, health can be impacted by the high rate of violent crimes, poor air, water quality, hot weather, noise, and also the place we live affect the behaviors we have. For example, if we drink, if we have a park to go, or if we drink a little or smoke a lot. So the place we live affect also the behaviors we will have. So health, the place we live, work and play, they are all connected. This is a very famous Brazilian author. He's called Gola, and he's well known because he draw all the situations that he was experienced, and he has some pictures like this where we can show that he feels in his stomach, in his head, and health is connected because he's one person. So we need to keep health, mental health, social determinant, all of them together. Pode ir. And how we can be fair, how we can provide health, how we can, in some way, pode passar, Ju, provide justice. We are dealing with a project to build a hospital in Africa. So how can we, put a seed of justice and equity? First of all, we need to know what equity means. So health equity is when all people have the opportunity to attain their full health potential. So it's be the best you can be, and no one has disadvantage from achieving this potential because of social position or other socially determined circumstances. So let me show you some examples. The next slide, I have a cartoon. Pode passar, Ju. A cartoon. So what I want to talk about? So this is a guy, and I want to talk about equity, which workplaces they do a lot, and equity and equality. So we can compare using the analogy, giving everyone the same thing, like a health benefit, like an insurance that everybody has access to the same health services. What happens? This is not fair. We give to everyone, but it's different the need of each one. So an equitable distribution will take into account what you need, what everyone needs. So equal doesn't work for everyone. So keep this in mind. If you want to be to provide equity, you need to understand what every person needs, every population needs. Pode passar, Ju. So, and then we can face here in Brazil, it's really common in different parts of the world, the structural inequity. So, what is this? In this cartoon, everybody wants to watch the game. We see a boy with a yellow shirt, a boy with a purple church, blah, and a boy with a blue shirt. So all of them are going to watch a game. But who is going to do better? So when the condition of some population, some community, some company, a group of friends, when they are different and the system such education or health system is designed by only for one population, like white women, men, black. So if the system is designed by just one kind of person or population, all of the others won't be will be harmed. So imagine if I have a price or if I pay a different amount or if you get promoted, if you watch the whole game and describe the whole game, who will do better? Of course, the guy with the purple the purple shirt. So this guy will have benefit because the system is designed for him. So equity and structural inequity is when we have a system that is designed for one kind of person. Pode passar. So, as a woman, I have a system, I have places, I have business designs by men for men. If I am white, I have system research design by men, white men for men. So we have to keep this in mind when we read an article or when we are drawing a new project. So this is the view. This is what I am specialized in populational health view, and I want just to explain. Pode passar. What is populational health? Nothing new, also from the last century, but population based equity means that every group or every community that I want to know all of them, all of their needs, and I want to create clusters, and I will have to measure outcomes. So on the right side, you can see I need to consider, in my view, the culture, the community, lifestyle, the self-care, work, and the biosphere. So all of these, I understand they contribute to your health. Remember, I told you health is a state of well-being, mental, social, physical. So this is health. It's a complex self. And then if you have more or less equity, you have more or less disease burden. So you have more disease, less disease. If you have less equity, more disease to the population that is not part of the system. And if you have inequity to the access of the system, or if you design services that don't provide health to all, you have less function, low outcomes, higher death rates. So this is the populational health view. We need to understand where people live, learn, working, how it affects their health, and how we can provide the better outcomes. So this is the view, this is the way you need to work in like a journey. It's not a small things. Unfortunately, you decide to work with health. It's a complex system and I need to work like this. Pode passar. So this is the approach. We aim to improve the health of an entire population. As a physician for 15 years, I worked on an individual basis. This patient came to me looking for liver transplantation, the second and the third one. Now, looking at populational health, I need to look what is better for this population. So it's about improving the physical and mental health outcomes, the well-being of people across a defined local population in reducing health inequality. So this is the view. This is what I brought to you. This is not new, but I think we need to build knowledge and build projects that encompass this view. This is a dream for me. So, pode passar, Ju. Now, coming to the end. Where I want to be. So, as I said, where we work, live, play, this is health. So, just want to highlight what is how much the work influences our health. Pode passar, Ju. So our workplaces, they play a significant role in our lives. So they are important. We need to work. We like to work. Pode passar. The work affects both our physical and mental well-being in good ways, in bad ways. So work is part of our health, is part of our daily routine. Pode passar. And when we had COVID, and maybe we can talk about that, I think Juliana has a wonderful project with us. When we worked with our employees, we had 30,000 people to take care and to bring back to the hospital. So Juliana, with her tools, she helped us how we need to create a scale, how they move back to work to the outside of their homes to the hospital, who is coming the first, the second one, how we can prepare the structures to receive this employee. So it was a challenge in Juliana, but then the COVID, so they brought to us the relationship between work and well-being. So it is clear for us that work and well-being, they are connected. Pode passar. It's not for us. My desire is that we move from cost avoidance and return over investment. This is old school. We don't work like this anymore. So I don't need to prove that work is important, that the business needs to make money. But the challenge here is how to bring health to the agenda of the CEO, of the board members. How I can put health together with the projects. Because if you don't have health, you don't have money, you don't have your business. So health and workplace, they need to move beyond this. So this is not mine. This is not my thought. Pode passar. This is I like a lot. This was published. I had the reference. It's free on the web. So the Surgeon General in US, he published a book where he states that we must build workplaces that are engines of well-being, showing workers that they matter, that their work matter, and that they have the workplace and resources and support they need to flourish. This is the message. This is what companies need to do from now on. This is a book. So this book is a foundation, and all the workplaces, all the company can build upon 10 states: safety, security, social support, belonging, flexibility, autonomy, meaning, dignity, accomplishment, and learning. So, this is my call to action, the workplace. We need to make the time of that person matter to us as an employer. How can I honor the time you're giving to me and the time you're giving to me watching my talk? I need to honor this time and make you, you need to know that you are important. So this is a call to action where he puts health and workplace in the same book. So I invite you to read. Pode passar. And okay, I understand health, mental health, okay, but I don't want to talk about that. So, okay, you don't want to talk about that. So, I also brought you what happens if we don't change anything. Pode passar, Ju. If we don't change anything, we'll have a toxic corporate culture. So there's a lot of articles showing that when you work in a toxic environment, what happens? Turnover. People leave your company. So they don't want to stay anymore. Pode passar. So here is an article published at MIT, so I can send you, where they compare toxic cultures and non-toxic cultures, and the percentage of person that they say, okay, I'll leave this company in the next 2 years. So this is the scenario published in the beginning of the year. Pode passar. What happens? 41% of women, they are more likely than men to experience a toxic culture. We don't know how to deal with women, with diversity. We need to learn. We need to have a space for them, to include them. Pode passar. This is another article where they show that sexism and abuse management are the top of the list of toxic behaviors. And what happens? They will leave your company. So we have a movement, a silent movement of women, 50 years old like me, they're leaving because they said, I don't want to stay here. It doesn't make sense to be here and to face sexism and abuse management. So if you don't look at health, you have to deal with turnover with people leaving your company. Pode passar? So more of the same. Toxic workplaces can take a toll on your mental and physical health. So if you don't cure your environment, your workplace, people get sick, and you have to pay the bill, the cost avoidance, the return of investment. And also, if you don't look at equality, if you don't provide equality in access to healthcare, people die. If you're black, you are 100% more, you die 100% more times than if you are white, if you have diabetes. You die 20% more if you have heart disease, and 30% more if you have cancer. This is unacceptable. So, if Black Lives Matter, we need to understand inequality, and we need to to design projects and systems that provide equal system, equal access for all. Pode passar? So also education, the more educated you are, the more employment you have. So, okay, I don't want to deal with health. Okay, let's talk about education. If you don't provide education for all, people won't have an activity. They won't make their own money. They won't contribute to the community. So remember, if you don't contribute to the community, mental health will suffer. So everything is connected, and we have to start from some point. Pode passar? So, like the secret, so I'll share with you 5 minutes, my secret, the strategy, how we can start or how we can draw a strategy. First, pode passar, Ju, já tô no Mind the Gap. Pode passar. First, as the London Tube, Mind the Gap. So I love this figure. Is from a place called King's Fund. It's a think tank in London, and they say you need to watch the gaps. So you need to put all these things together: the determinants of health, the behaviors, the lifestyle, the healthcare system, and the communities where people live. And you have to look to the middle, into the gaps. What this is where the opportunity and the innovation they are there. They live there. So first of all, mind the gaps. Second, pode passar. Think system. Don't think like small. Okay, you have agility, we have to set goals. Okay, but keep in mind, we are part of a wider system that needs to work like this. You can stop because people die, people get sick. So think like system, keep things together. Okay, you will approach one problem at a time, but keep them together. Pode passar? E aí pode passar de uma vez. So health is about people. Health is about connection, is about leadership, is about relationship. This is the future of health. Pode passar. Future of health is connecting all the dots. The individual, pode passar, já isso. The individual, the leadership, and the organization. This is the future of health to me. Pode voltar. And if I don't convince you, last slide. So health and wellness are performance. Pode passar, Ju. This was published last week, where they show that the higher the wellness, the higher the productivity. So wellness is related to productivity. So let's talk about health in the workplace. Let's talk about health in your company, in your project. Pode passar, Ju. Let's talk about the elephant that lies in your living room. So that's my message. The elephant I'll leave for you, my friends. André, miss you, my friend. Genius. So thank you. Thank you for your time. I hope you enjoyed. And feel free to send me questions or anything.
What amazing presentation, Raquel. Congratulations. Well self-explained, very detailed, and very tricky, because now we have a lot of elephants in our rooms to think about USA. So it's very special. So thank you very much for being part of this first seminar. And now we're going to have André who is going to join us and make the presentation. André, please come to the stage. Thank you very much for your collaboration. And I'd like that you present yourself, that our colleagues here can see all over the globe and understand who you are. And please move forward with your presentation. And Raquel, once again, thank you very much.
Well, good night, everyone. Are you guys listening to me? Yeah?
Yes.
Great.
Crystal clear.
So, first of all, thank you, Juliana, for the invitation. Long time to see you, Raquel. I would like to say to everybody that I am honored because I could work with Juliana and Raquel. They are both my former co-workers, so it's very nice to be here with you once again. So let's go to the presentation. I'm gonna tell you a little bit about how we are building a strategy to take the data we have stored in our data lakes and make this data bring value to the patient journey. Okay, please let me know when you get my full screen.
Yes,
Yes.
we can see.
Okay, so let's go. I will begin this presentation by giving you guys a clue about how complex is our health systems. We have about 40 units in public sector and plus 20 units in the private sector. And we go all the way from low complexity to high complexity. So we began to develop a platform looking for some of these healthcare units, but we quickly were facing a challenge to make this platform spread for all our ecosystem. And that brought a lot of challenges because we have different EHR systems, different financial and ERP systems across all these platforms. And then we were thinking about our patient mobile app, our physician's outpatient EHR, and how could we connect with one digital front end, all the patient journey, and how could we interoperate data between those different units, each one having your own EHR, each one having your own process. And we are talking about basically three different kinds of people here. We have the public sector, we have the premium private sector, and we have accessible private sector. So very different protocols, very different process. So this is the challenge we were presented of. The first challenge we got here, it's to, whoa, apparently I forgot to translate this slide, but there's no problem. So the first challenge we got here is that we have a patient decentralized ecosystem. And we were trying to make the patient and its journey to be circling around the patient and make the care goes through his empowerment in the center of the journey. So we want the patient to be the core of the healthcare journey and have control of it from the beginning to the end. But we want to assist the patient. We want to let him know what are the decisions he has to make and which decision and the consequence for each decision he will make along the way. So in order to do that, we are looking for a platform that allows us to expand our care through different locations. We aim to integrate data, not only the data that comes from our electronic health records, but also from the patient wearables, also from data the patient gives to us when he updates his register or his account in our mobile app, or any kind of data that we can get from different diagnoses, from different disease, from consultations he will make in another healthcare providers. All this data can be combined and showed to our physicians and to our patients in one single system. this platform aims also to make his digital journey and his physical journey while he's inside our units go in a more fluid way possible. So we basically want a seamless experience without any kind of disruption between the digital and the physical. The patient also has the improvement of being able to orchestrate his journey and to go from a low complexity facility to a high complexity facility with a continuous of care and an integrated journey, so he won't have to answer the same questions to the specialists that he has already answered to the primary care physician. Another slide so we can show a little bit more about our complexity here. We are no longer a health systems that are able to make the patient take his care only with us. We are very connected. We are connected to another healthcare providers. We are connected to corporative companies. The patient work for these companies most of the time, and he are also a part of his care. So we have more than 50 customers who are integrated with us, and we exchange data with these companies every day. Of course, we have privacy issues here. Of course, we have legal issues, and we have to make this integration work in a very high scalable way, because it's millions of patients exchanging data with us automatically across many systems every day. This data doesn't came only to this digital platform that is the front end for the patient and for the physician. This data has to come for all of our ecosystem. And since we want to exchange data easily with different healthcare providers, we also have to build integrations with software providers, who are the most common software providers here in Brazil, to make easier for us to build partnerships with different healthcare providers and make plug and play to exchange data with them in a managed health system which is integrated. We have a couple challenges here that we have set as our goal to this digital platform. The first one, we have to share integrated data with local health to serve populations in prioritized regions. So interoperability has to exchange data fluidly. We have to be able to manage quality from third-party healthcare providers. So we have the data, and we have to analyze the data and make sure these consultations are following our protocols. We have to engage patients in their self-care, because we won't be able to look for the patient 24/7. So we have to be able to make he feels like he is improving his health, and he can see how much progress he is doing along the journey in real time. We have to navigate the patient between the different complexity levels of the system and to maximize our effectiveness. So the platform also has the mission to improve our capabilities, our productivity. So in order to set a couple goals here, we have to make a stand for what we believe it is going to be this role, how we are going to planning this implementation, and what are the red lines for this new technology. First of all, the question we have to make ourselves before going to a journey where we will build from the scratch a patient digital journey is, how open should we define our whole? How we ourselves are truly looking for an open health and a collaborative ecosystem? That's the first question. The second question is, what are our barriers? What kind of technology needs we have to meet, and how can we provide an architecture that is resilient enough to make this journey happen. And the third question is, how can we organize ourselves and change our way of work, our culture, to make this project possible? How can we use agility and build a new process to developing software that will allow us to get where we are aiming of? So we have made those questions, and the first goal we had to meet was to change the way we see our softwares. We came from a technology that it's very modular and it's very monolithical. And we had a deep effort to make this platform be modules that we could manage, and they could evolve by themselves without any needing of different systems, and we are not making deep coupling between our softwares, and it's evolving. So we could bring independent modules with independent strategies and independent teams working together to reach this goal. We have a couple examples here. So now we have a scheduling module, a module specific for exam results, prescription modules. And once we are able to build this new architecture, we start to use this architecture to make our services evolve. So we went from a monolithical topology for a microservices strategy, and then for a service-driving strategy. So we start to pick the modules who build a journey, for example, for hospital at home, and we combine these different modules in order to make these new services go to the market. And this goes for services that we provide alone as a healthcare provider, to services that we need partners in order to provide. So, for example, if our nutrition services wants to connect with a gym, we will have to have integrations between our platforms. So your nutritional prescription can go to your personal trainer, and you have a continuity of journey in this new environment that is not connected with us only through the platform, except for the platform, actually. So looking for the future and how to build those integrations, we have a couple notes here that I think are pretty general, and they are up to date to any health system nowadays. So the first thing is, we already have a partner to exchange data. We shouldn't get our IT team to create integrations from scratch from the way we think should be. There is an international protocol here, which is FHIR. And once we build an integration using FHIR as an integration protocol, we will be able to scale this integration to how many partners as we want. So don't build integrations from scratch, use FHIR. That's the first recommendation. The second recommendation is the EHRs will still be the EHRs in the future. So those are very well established solutions. It's not the way to try to build your own EHR or believe that a new EHR will come and solve all of your problems. That's not how the marketing is organizing itself. Instead of that, you should think about how can you improve your patient journey, connect with your current EHR, and FHIR can help you to do that. The third recommendation here is a long-term process of integration and digital transformation has to be very deeply connected with your data strategy. So it's important to consider your data structure, your analytics structure in a way that you can actually use your data to generate value for your patient in his journey by individualized care, by connecting databases so you won't ask the patient the same question over and over again. And by the end, to build artificial intelligence, don't believe you are gonna make possible your journey be fulfilled with artificial intelligence by building all artificial intelligence yourself. The future is many organizations will have many AI algorithms, and each organization are going to consume AI algorithms from other organizations as a service. So we believe that in order to evolve quickly your journey, and in order to actually make the AI a reality of your organization, you should not try to build everything and look for the market and look what we can use that is already being done for many different providers. Well, here we have a topology about how this might work. And our suggestion here is you will always have a layer from your legacy applications, and they will continue to exist, your CMR application, your EHR application, and everything. Upside your legacy applications, you have to share data. And then you will have a layer where you make the journey of your patient be fulfilled with the data you already have. And this data will be managed and integrated in databases that has the ownership of information, and every system that needs some data has to take this data from this owner of source of the information. In order to make this data layer connected with your front end, you will have to build a strong hub of interoperability. And as I said in the previous slide, this hub of interoperability must use FHIR, so you will be able to scale and to create layers quickly, rapidly, and you will be able to connect these layers in more applications with less effort every time you deploy a new endpoint or a new API. And last but not least, the front end has to be built considering the inputs of your patients. Your customer experience team has to go into the field, listen to the patient, listen to the physicians, get the data from your data lakes, and combine this data you get from your patients and from your systems into your strategy. So the principles I would like you guys to understand here before we go for the actual cases, which is for me the most important. Build a platform as a product, not a system. You have to understand which are the KPIs you want to change, which are your OKRs. You have to look for your data, and you have constantly talk with the physicians and the business areas, the corporative areas of your industry, of your company, in order to discuss how to achieve the goal, and not ask what to be done. IT and the business areas has to build a strategy together, data-driven, and make all the effort goes through your objective. You cannot go to each area and ask them what to do, because they will have a very small vision of the whole ecosystem, and probably they will drive you to evolve your platform for specific objectives, but these specific objectives won't take you from where you are to where you want to be. The second is to structure environment where you have partners to evolve your platform that and these partners must believe the journey is the same journey as you believe. So your platform and your partner's platform has to evolve in the same way to address the same goal. Cloud first. A digital platform cannot run on premises by definition. You have to exchange a lot of data. You have to be able to scale and reduce your computer capacity every day in a very dynamic way that you won't be able to do with internal and on-premises infrastructure. And the most important, constantly, every day you have to look for what you are building and to see how can you bring value to your business with what you already have or with what you are bringing to the table right now. So it's not the goal here as an IT staff only looking for what you have to deliver. You have to understand the role your delivery plays along the business and how are you helping the business to achieve new KPIs, to achieve new OKRs. Okay? So, no more talking. Let's go to the cases. I will just unshare and share my screen once again.
I am mute. Sorry. André, thank you for sharing the digital transformation journey of a major healthcare play in Brazil, the hospital, Einstein Hospital, and the challenges faced as the care journey is still fragmented. Thank you.
Well, so just for go to the cases, I brought 3 cases here, very practical about how we are using the data. Okay. The first case is we have a virtual emergency room services, and we use AI to predict how our queue are going to evolve along the day. It's a very simple algorithm. We basically have our history of consultations, and we use our history and the curves we have in a daily basis to predict how our queue are gonna behave along the day. And this way we can manage our medical staff in a way that we will always be well projected to the amount of consultations we will have to perform. That's the first case, pretty simple, pretty objective. The second case, as you can see here, 47.7% of our patients are currently engaged in our mobile app. We are striving to make this number goes to 60%. That's our goal. By the beginning of this semester, the number were 35%. So how we used our data to create a strategy to make this number goes from 35 to almost 50% and 60% in the next couple months. We have created this dashboard that allows us to understand which services we have the most volume of patients. And based on that, we went to the field and asked the patients what they believe would help them with their journey in those services, which we have more amount of patients every day, to let us know what kind of features would help them engage in our digital platform. So as I said, we already went from 35 to 47%, and we are very optimistic that our autonomous physician journey, our emergency room journey, and our diagnostic patients are engaging with our platform because of the features we have built in those 3 services, which has more volume in a daily basis. And the third case, I brought to discuss with you guys here. It's this dashboard where we have make the time our physician spent in the medical record for each register drops from 11.4% to 8.9%. Sorry, 11.4 minutes to 8.9 minutes. We were able to accomplish that by making algorithms, make suggestions about which he should fulfill in the EHR according to with the patient data, diagnostic, sex, age, and everything. So we are facilitating the process of the physician fulfilling the medical record through AI recommendations. And as you can see, we are already being able to get some results with this integration as well. So those were the cases I brought to you today. And now we can discuss or answer any doubts you guys have.
Juliana, and any
Thank
question?
you, André. Thank you. Thank you. Congratulations on the presentation. It's clear. It's not easier. Thank you.
André, let
Okay.
me make you a question here that was sent here for us. It's about what's the biggest challenge that you have facing this kind of projects that you're running. So how was the most difficult part that you had in order to make this successful as you're showing these cases? So if you could share some experience that you felt in the field by managing and providing this kind of solution, what was the most challenging part that you have this project?
The most challenge, it's difficult to say, but I will say some of them. I think it's difficult to technically speaking. I believe the most difficult challenge, it's to build integrations with the new systems, the new journeys you are creating with your legacy systems. The legacy system doesn't have a FHIR protocol in place. They doesn't have easier ways and modern ways to communicate with the platforms, and so they always bring a challenge about how are you going to make this journey works. This is technically speaking. I think in the financial way, you have a constantly challenge to show what we have brought to the table as a value for what you have spent, how much money you will have to invest to make the new steps, and why it's important to make these new steps in order to build the future you are trying to build. So this it's an everyday battle to keep everybody updated about which are the next steps and how the money you are investing will return for you in a long term. This is the financial challenge. And for the business challenge, I think we face a very dynamic market and that is evolving very quickly. So a couple years ago, it was normal to take a 2 or 3 years IT project. Nowadays, when we talk about 5 months, it sounds like an eternity. So I believe to manage those expectations with the reality, it's the challenge to the business perspective.
And regarding the people perspective, when you talk about soft skills, you are in a very complex organization. You have a lot of sources of information and different owners of this part of this information. So I guess it's challenge that you need to get in the field and different stakeholders that you need to align. So when you're talking about business, you have talked about the technicality, but when you talk about to build the bridge between the business and the the technical solution, it's about people. How was the challenge regarding this part during this process, which I believe that's an incredible journey that you did. It's incredible some cases that you just showed to us. How was this journey regarding this management of egos, wills, wantings, wishes, and you needed to combine these all together and bring a solution. So how was this kind of challenge for you, and how did you manage yourself in order to move forward? Because I guess it's the most difficult part regarding managing something.
Well, regarding to external expectations, I would say that basically you have to identify your common goals, set those goals on priority, and then build a high-level plan, a high-level strategy about what are you going to prioritize, and give everybody credit for the efforts. So take a common goal and align this goal with everybody and make everybody part of the solution, and make sure you are giving credit to everybody that is actually involving in doing the hard work. I think it's not easy doing that every day. So people have different expectations, and cannot make everybody happy all the time. But I think it's a good way to begin. And about myself, I think what I could say is that I have learned to not be too much happy when things are going well, and not to be too much sad when something go wrong. I think you have to try to be in the middle of the happiness all the time, because other way it's very exhausting, and you will get very anxious every day.
Just to go to go into the end, and then Juliana is going to share some words too. If you could talk to yourself 15 years ago in order to speed it up your process of managing solutions and this kind of complexity, what kind of tip would you like to give to yourself, and you could share to people that's coming right now? Maybe people that have more time of experience than you, but they do not have the managerial ego as you have in your career or during your path. So what kind of tip would you like to give yourself 15 years ago in order to speed it up a process, or to have less stress? Because it's a part of the process, it's a part of the nature, but sometimes we can avoid how we react. So what would you like to share to the public regarding this experience?
Well, I would say that, as Juliana probably remembers, I'm a stubborn guy. So I think I could have a more easier path than I had if I were able to listen and try to learn with other people experience, instead of trying to do things my way and have to fall before learning something that I could have learned just by looking at my co-workers. And the second thing is that as a technical developer, we always want to build things. We like to engineering. It's what makes us happy. And sometimes we close our eyes to easier solutions that goes for taking a partner to address your needs without having to building everything, or to understand that you have pitfalls that you can avoid if you share your challenges with more partners instead of trying to do everything on your own. So I think those are two advices I would give to myself as a teenager.
Thank you very much, Andrea. Juliana, last words that you'd like to share. This is our first webinar regarding this group regarding the healthcare SIG group in IPMA. So we are very happy to be here to share experience with you all. So Juliana, please, last words that you can share with our colleagues who are watching us, and some of them that are going to be part of us, that we together can move forward society, that we can help people have better treatment, have a better attendance, and more than that, to develop society. So Juliana, please, last words.
I believe that effective project management plays a crucial role in response to global risk or new projects, enabling organizations to face a complex challenges, adapted to change and promoting sustainable. I believe the disciplined approach to project managing allows organizations to plan, execute, and monitor initiatives that directly address the aforementioned risks and challenges, and contributing to a more resilient organization. It's only that.
Juliana, thank you very much. Andrea, thank you very much. You made an incredible presentation, very insightful. Thank you for your times. And for those who are here, wait for us. We see you in a couple of weeks together to talk more about project management in healthcare sector. And if you have a team or something that you'd like to bring to us, please be in touch. And we're more than willing to address your questions or to create a webinar team in order to fulfill it. So thank you very much, Andrea. Thank you very much, Juliana, and all that's watching us. So good night for all. Thank you.
Good night. Thank
Thank
you.
you.
Bye
Bye-bye.
bye.